So today I have the honor of having Dr. Tim Latham with us, and we're gonna speak a little bit about what Tim does and what about his upcoming workshop at Clientele. So Tim, can you give everyone a little bit of a background about what you've done and how you came into the fitness industry?
Certainly, yeah. So I grew up playing sports, as a lot of people did, football, baseball, basketball, and as I started to play increase in frequency in high school and in summer ball and college ball, I was one of those guys who just kept getting injured. I had a nagging shoulder injury that nobody could figure out. I saw all the best orthopedists and physical therapists, so it was around that time where I stopped playing college ball from one final injury where I was choosing majors. So I decided let's go into the rehab field. I had a positive experience with a chiropractor growing up, so I said let's do it, and went into decided to enroll in New York Chiropractic College after undergrad, and kind of had a focus in sports rehabilitation just based on my own experiences. So that was grad school, and then coming out of grad school and getting into practice, I decided I wanted to diversify a little bit more, so I went back to school and did a master's in human nutrition. And then my wife and I are both the same way. We're super curious, super driven, and just want to be the best at everything. So I went back and studied exercise science, became a certified strength and conditioning coach as well. So that's kind of where we're at now. So we try to integrate movement, nutrition, rehab, all together.
Gotcha. Can you speak to us a little bit about, how you take what you do and how you apply it to the fitness industry specifically?
Sure. I think traditionally in rehab, pain management, and fitness have all kind of existed in separate silos. And someone gets injured, they go to PT, they do well, they're feeling better. So there's almost this chasm between what happens in the physical therapy clinic and what happens in the fitness industry. So what we're trying to do is just bring those together and make sure that when people are rehabbing an injury or they're experiencing pain, we want to make sure that we give them the capacity and make sure that they're able to tolerate what they're going to be going through in the gym and in their daily life. So we're just trying to bridge the gap a little bit between rehab and fitness.
Okay. So I know you have a background in chiropractic work, and just being in the fitness industry, I know that it has kind of a negative stigma around it sometimes, just
Sure.
because it's unconventional style medicine and even like physical therapy.
Yeah.
Can you speak to us a little bit more about like how your approach could be, just because I personally have worked with Tim for myself, and I know that his approach is much more evolved than like traditional chiropractic work. So if you can explain to us a little bit more about that.
Yeah, I think a lot of this stems from some of the sort of the old guard in chiropractic, and you spoke to it. They were always clashing with the medical profession, and chiropractors were very set in their ways, and they only saw things through the lens of, you have a spinal misalignment, we're going to correct that, and that's, sort of the root of all evil. But as I spoke to before, Laura and I and a lot of more forward-thinking chiropractors in the industry, we're expanding our viewpoint of what health looks like. So we started to take tools from other professions, physical therapy and fitness, and at the end of the day, we're just trying to get people to move better and feel better and eat whole foods and manage stress well and sleep better. Like, that's where the magic happens. So we're just trying to remove barriers for that, and we don't feel like we need to adhere to what traditional chiropractic was. And as one of the sayings go in our industry, it's if you go see a good chiropractor or a good physical therapist, you shouldn't really be able to tell the difference, because if you're practicing evidence and science-based, what the research is telling us, then you're doing the same thing. And our scope of practice and the physical therapy scope of practice overlap significantly. And at the end of the day, nobody owns movement, nobody owns strength training, and those are the things that are really important. So that's what we chose to focus on in our practice. So yeah, that's where we're at.
So based on you mean your career, can you name the top 5 injuries that you've seen? Let's list it from like the most frequently seen to like the least.
Great question. Yeah. So I think because we're chiropractors, that the people that contact us tend to be the back pain, neck pain type. If we were to list specific injuries, sort of disc herniations, disc bulges, things like that. But at the end of the day, so many of the things that we see are non-specific, where we don't necessarily want to attach, a type of tissue damage like a low back sprain or neck sprain, disc herniation, because we would treat them the same way. So, but if we're going with that, low back disc herniations, neck disc herniations, low back sprains, I'd say hip impingement and rotator cuff pathology. So low back, neck, hip, shoulders, probably the most common.
Gotcha. So there's a perfect segue into my next question about your upcoming workshop at Clientele. We kind of named it Gainz Despite Pains.
Yeah.
Can you speak to us a little bit more about like who should be coming to this and what they should be expecting to take away from it?
Yeah, great. So I think anyone who's in the fitness, wellness field, you work with people from a movement perspective. So this is rehab professionals like physical therapists or chiropractors. This is fitness professionals, strength and conditioning coaches. Anyone who works with someone in movement and strength training and you see people who are injured would be a good candidate. Because what we're talking about is keeping people training. We're talking about preventing injuries in the first place and then properly managing injuries once they're already here. So we don't want people to have a setback or a gap in their training. We want to be able to work around injuries and optimally prevent them in the first place, but that's not always the case. So we're going to talk about the myriad of factors that go into people getting hurt in the first place and people ending up being chronic pain patients instead of continuing to work in the gym. So we're going to try to bridge that gap again and teach people what pain means, how to manage load. We're going to talk about biomechanics and technique. We're going to talk about the importance of stress and sleep and how that plays a role, and also touch on nutrition a little bit too. So our goal is to give everybody practical take-home tools that they can start integrating in whatever their professional setting is on Monday morning.
How about for people who are not in the fitness field or professionals and they are just looking to potentially just learn some things to manage their own pain? Would this be the workshop that they could attend as well?
Yeah, absolutely. I think if you're someone who has a lot of years in fitness and training and you have experience with injuries and you want to learn some fundamental principles for staying pain-free or managing pain if you do have it, then yeah, absolutely. Yeah, we'll take a unique individual who has enough experience and they're comfortable with some of the language, anatomy and physiology type, but yeah, I think so.
Okay, great. Well, that's it for today, and hopefully we will see you at Dr. Latham's workshop.
Thanks, bud. Appreciate it.